so it's funny. Most people will come in and say, "Hey, I want my smile to look better," and sometimes the only thing they'll be thinking of is veneers. Sometimes there are other options. So, if their teeth, for example, are structurally really good and there's nothing that would inhibit them from going through whitening process, then a lot of times whitening and Invisalign, that may be enough, right? That may be enough to get the person the smile they want. Oftentimes, for the patients that I see, it's their teeth are to the point where that's not going to work, right? I mean, there's chipping, there's wear, there's old fillings, there's old crowns, there's other things that are really inhibiting the aesthetics of their smile or the function of their mouth. And so that's where we start looking at the veneering process. And veneers, there are a few types of veneers as well. We can do anywhere from a non-prep veneer where there's no prep work done on their veneers to a minimal veneer prep to a traditional veneer prep, right? It just depends on the circumstances of the teeth, their structure, their health, the position of the teeth, all of those things come into play. So the way that veneers look is very subjective to the individual, right? It's like the saying they say, beauty is in the eye of the beholder. And that's one of the things I love about what I do is everybody has a little different vision of what they want their smile to look like. And so I will, I call myself the tour guide of their smile design, right? I'll give them some options. I'll point out some different ways of doing it. I'll give them, my feedback. But ultimately, everyone's going to have a little bit of a different opinion. I mean, I have patients that are anywhere from, I want the white, perfect Hollywood smile, everything straight, everything same length, to the other side where it's like, I don't want people to know I had anything done to my teeth. I want it to look as natural as possible. I'm even okay with little imperfections and, one being a little different size, like just things like that. I mean, it's really the spectrum of that I see in my practice. And so that's why it's so important to, one, have a lot of conversations about what that patient's looking for, and two, do the process that I do that's very systematic to ultimately get to the final result that they're happy with. So veneers actually, and this is an interesting conversation because a lot of times people are like, well, this is just a cosmetic procedure. And a lot of times, again, the veneering that I'm doing, I'm restoring health and function with the veneers. So sure, we're going to make them look great, but we're restoring the functionality of the teeth, the way the teeth work. In fact, a patient I saw last week, he was an older gentleman. He's like, well, I don't really care how my teeth look. I'm like, cool, that's fine. But they were cracking and chipping and breaking down and they weren't working properly. And I said, okay, well, we're going to make them work better and we're going to make them look better too at the same time. Why not? And so he's like, okay, yeah, I can get behind that. And so it's just kind of interesting, how the approach is that people have this misconception of like, well, I'm not in Hollywood, I'm not in movies, like I don't really care. It's not only just about that, it's about the health and functionality of the teeth and making sure that they do last a lifetime. Yeah, before dental implants, our only options were, either bridges or dentures, right? And if you've ever had a denture, you would know you do not want a denture. And even bridges, bridges are tough to clean, and you're now turning a one tooth problem into a three tooth problem, and so it has some pretty significant downsides. With dentures, it's even worse. I mean, you lose your ability to chew properly. The dentures cover taste buds, so food tastes different. I mean, it changes people's lives. And we do these implant reconstructions where we're restoring people's mouths with implants. And I once had a gentleman say to me, and I've never forgotten this. He said, when I would go to a buffet, right? And when you and I go to a buffet, we look around like, all right, what do I want to eat, right? He would show up to a buffet and he would think, what can I eat? What am I going to be able to chew, right? He's like, that's how it was for me. He's like, now I go to a buffet and I eat what I want to eat. And that for me is huge. And so I thought that was really simple but profound to hear someone's experience about being able to eat properly, and dental implants enable them to do that, which is pretty neat. We'll call it modern implant dentistry, can be done in a really non-invasive, minimally invasive way, and can be done pretty quickly now compared to where it was, 10, 15 years ago, and really can change the way that a person feels about themselves. When people are missing teeth, there's a confidence hit in that, right? And also just the way that people are able to live their lives and chew and function and in social settings, all of those things really have changed the game as far as implants go. the number one tool for minimizing discomfort is the sedation, right? IV sedation. It's interesting. I have patients that go through sedation for various procedures, and they'll say to me after, like, "Why would I do it any other way?" And I say, "Exactly. Why would you? You know, because nobody likes going to the dentist, right? No one likes getting dental work done. I don't even like going to the dentist, right? I don't like being in that chair." And so the sedation is such a great tool to help people be comfortable, relaxed, and actually in a safer state while they're getting their dental work done. And so that I think is very significant. And also with the sedation, we're able to give medications in the IV that help with inflammation and pain. So it does help the recovery process as well, which is huge. I think the fact that we have a team here of, not just on the lab side, we have our own lab, which is fantastic, but a team of specialists and doctors that work together to be able to make sure that even the most complex cases are addressed properly. So I think that's a unique thing about our organization, our group. Again, being in Silicon Valley, we've had to innovate a little bit, right? And I'll have patients who they'll say, "Look, I'm in board meetings all day, whatever, interviewing people all day. I can't wear those aligners. They cause me to lisp," whatever the case may be, right? And so we'll modify treatment plans to be something where maybe they wear it late night, right? Or we'll have other patients that say, I need to be done, in an X number of days. I have a wedding or whatever the case may be. We have ways of doing accelerated orthodontics so that we can get them through the process even faster to meet deadlines or minimize the amount of time that they're actually having to wear the aligners. So there's different kind of spectrums and ways that we're able to help make it a better experience for people. And so one of the things is, we'll give kind of weekly check-ins, all these different strategies that we've used with people just to help make sure they're staying engaged, involved. Our, times when they come into the office to get checks and making sure they're on track. And if we need any, revisions or what we call refinements, we can handle them right away. So all of these things are designed to get people to their end goal because the nice thing with Invisalign is they are clear, right? They're hard to see unless you're really looking. So from an aesthetic standpoint, they're much better. But the downside with Invisalign is they only work when they're in your mouth, and you have the ability of taking them out of your mouth. And so if they're not in, they're not doing their job. And so it does take some hand holding on our part just to help people get through the process. In 2025, for adult patients, it would take a very significant issue to convince me that regular braces would be better. So the way that we've designed Invisalign, the way that we build the cases, the materials that we use, they're fantastic. They work really, really well, really predictably. And so it's pretty rare that I would say, hey, traditional braces are going to be better for you. The only time that I would recommend that is if a patient says very honestly, like, I know myself, I'm not going to wear them. I'm probably going to lose them. I'm sure my dog will eat them, right? Whatever, things like that. Then if they want to like just a brainless process, that's where traditional braces come into play because they don't have to do anything. They're on, they just have to get through the process. I think the most common question I hear from people is this going to hurt, right? They wonder about the discomfort of it. And also they wonder, how do I like get through my life with these, right? So from a pain standpoint, that is, again, another nice thing about Invisalign versus traditional braces. Traditional braces, you go in every 6 weeks, they kind of crank them down. It hurt like crazy for a few days and then got better, right? Invisalign, because it's such a gradual process with the trays, the discomfort is really minimal. I mean, you put the first tray on, you're like, oh, it feels a little snug. That's it. And then within, hours, it's like, okay, that feels normal, right? So that part is really nice. The comfort level is much better with Invisalign. From a lifestyle standpoint, you don't eat with Invisalign, so you really have them in, under normal circumstances all the time until you are eating, brushing, and flossing. And what I tell patients, having gone through it myself, is it gets to the point where it's like putting your shoes on, right? It's just part of your routine. It's what you do. And when you don't have them in, you're like, wait, I forgot to put my shoes on. Right? It feels different. And so it takes a few weeks to get to that point, but that's what I find and I've found as being the reality of going through that process. The optical properties of ceramic, which is what we use in veneers and crowns, etc., is different than the optical properties of regular enamel, tooth structure, right? And so even though you can choose the exact same color, because of the changes in optical properties, in certain lights they can look different. So the key to that is the way that we layer the ceramic. And so having very talented ceramists, and as I mentioned, we have our own lab, we're able to go through and get all the different layers built into the ceramic to really mimic and reproduce what we're going to see in a natural tooth. So that gives us our best chance of mitigating those differences in optical properties so that in the end, no matter what, they'll look the same. With dentistry and comprehensive dentistry, it's a balance between time and money, right? And so some people are like, hey, I have more time than money, so let's space this out and just do little bits at a time and spread it out over a long period of time. Totally doable. Other people say, I have way less time than I have money, and that could be relative, right? And so in those cases, like, okay, well, great. Well, you need all of this done, whatever X is that needs to get done. Well, guess what? We can do it in one visit. So we can do it with using sedation, using our technology, get it all done in one visit, and then it's done, and we move on with life. And so, especially here in the Bay Area and Silicon Valley, that's a really appealing option for most of our patients. One thing I am very clear with patients as they're going through cosmetic procedures is you don't undo it, right? There's no going back. Even on prepless veneers, when we do these prepless veneers, when you remove them, there's you got to polish glue down and things like that. So it's a process to go backwards, and so it's always, in my opinion, worth having the conversation of them fully understanding what they're committing to, and actually really committing to it, and say, hey, this is what you're getting, this is what it's going to do for you. We know it's going to change your life, but it has to be something that you want to do and you're committed to. And I always tell them, like, when we go through, we'll call it the interview during the consultation process, I might not be the right fit for you. You might not be the right fit for me. Like, we have to decide together that we want to work together because it's a commitment and we're going to spend a lot of time together and trust each other. And we want to make sure we're both on the same page during this whole process. So it's something that I think is very individual and very personal and needs to be part of the conversation you have in the beginning. When I go through my consultations with my patients, they all come with kind of their laundry list of questions. And I know the most common questions are, how long does it take? Is it going to hurt? And how much does it cost? Right? Those are the three most common questions that people ask. And as people are going through and asking those questions that they have, if one of those three aren't asked, I'll ask it for them because I think that's important for everybody to know. And so, they'll go through and they're asking the questions and we're going through it. And I'll always say, well, what kinds of questions do you have? What other questions do you have? And when they say, well, I think that's it, and they haven't hit those three, then I'll say, well, let's talk about if it's going to hurt. Let's talk about how long this takes. Let's talk about how much it's going to cost, right? So those are the three things that I think are, no matter what, are important things to make sure are addressed during that initial consultation.